Hi everyone. So when you are studying for the USMLE Step 1 exam and you are just starting, you need to understand that the big component of your preparation is not just the resources but also the study plan. I have seen those students who have the good study plan, they not only stay on the track but they perform really well on the exam. And also they perform better, much faster when they have a very good study plan. So my name is Dr. Mohammed Shah and I wanted to give you some tips on how to create the study plan when you are preparing for the USMLE Step 1. The subject line for this Step 1 is anatomy, physiology, biochemistry, pharmacology, pathology, microbiology, immunology, and behavioral sciences. I know as an IMG, some of the schools in different countries do cover the behavioral science subject and some don't. So you need to make sure that your study plan contain all of these subjects, including the behavioral sciences. Also, you need to ask yourself some of the questions when you start creating the study plan. What are your strengths and weaknesses in each subject? You have to evaluate yourself from the start. If you are IMG who graduated many years ago, you need to create a study plan based on your strengths and weaknesses. I would suggest taking an MBME exam or any of the self-assessment exam that give you some sort of idea what are the strengths and weaknesses you have from the beginning. And when you cover all the subjects like first round of review, then you need to recreate a new study plan based on your strengths and weaknesses at that point. And you have to evaluate yourself with the self-assessment exam again. So I recommend students to evaluate your strengths and weaknesses from the beginning. Okay, once you know your strengths and weaknesses, you need to ask yourself how much time you have available. Are you a full-time student? Are you a part-time student? Maybe you have your rotations going on, or you have a work commitment or any other commitment, like maybe in a master's program. So you need to know how much time you have in the day to study. I noticed that some students ask me that how many hours is really good time to study each day. I would suggest between 8 to 10 hours is a really good amount of time to study each and every day. And how much time it takes to pass is step 1. Well, it depends on your strengths and weaknesses, how much you know the basic sciences, but at least I would say that with my experience, I have seen IMGs usually take about 6 to 9 months of preparation to pass the step 1, and sometimes it's shorter because they have a very good understanding of the basic sciences, but average between 6 to 9 months, I would say. Now, once you know your availability and okay, I have limited availability, of course it will stretch your time, right? So for example, you are working somewhere or you're doing your master's program, so your time to study for the USMLE in any given day will shrink. Instead of 8 to 10 hours, maybe you have only 4 to 6 hours. So it will extend the overall preparation time, but it's pretty doable when somebody have other job or somebody have other commitment and continue studying for the USMLE preparation. I would suggest allocate your time to prepare for each subject according to your strength and weaknesses. For example, your physiology is one of the weak subject in assessment exam, but you have done a very well job on any other subject, right? So now you have to create the study plan. You give yourself at least, for example, 10 days to each subject to cover. But physiology, since it was a very weak subject in your assessment, you need to give enough time to it, maybe 15 to 20 days. Now, I have also noticed some students, what they do, they give themselves about a month to cover one subject, which is a mistake because, for instance, you have 7 subjects. By the time you cover the final subject, which is 7th subject, you will probably forget a lot of information. Having a proper passing in between the subject is really important. How much time is good amount of time for each subject? I would suggest 10 days. 10 days for each subject is really good amount of time. Now, some subjects require conceptual understanding like physiology and pathology, okay, biochemistry. There is a lot of concepts involved. but some subjects like require heavy memorization. For example, pathology, microbiology. Pathology contains a lot of connections. You have to memorize so many things. Anatomy, like immunology, subjects like that, you have a lot to memorize. So make sure that you're focused on the subject to understand and memorize at the same time. But your understanding is extremely important. Once you know you're progressing, once you know you have completed all the subject, don't forget to recreate a new study plan, because you don't want to continue with the same study plan and repeat it again. Once you complete all the subject, take an MBME, and after taking an MBME, you need to create another study plan. Basically, you revise this study plan. Okay, here are some tips that will help you in your study plan as well as in your studies. Make sure that you limit your resources. Okay, you don't want it to overwhelm yourself with too many resources. I know there are so many books available on preparation, so many video series, so many question bank, but you have to pick one and stick with it, because you don't want to get the same information from the multiple resources. What will happen, it will dilute your information, like performance will decrease, and you probably will take much more time to improve. So limit your resources. One book, a review book, that's good, and you understand that book, that's good enough. Video series, that's good enough. In future, I will make more videos about the resources, so I will tell you what type of resources you should be using when your performance is really high and from the start, or you're performing really low from the start, and it's been so many years you have graduated. So I will make some videos on resources. I will also make some videos that how much it will cost you to prepare. So don't forget to subscribe and hit the bell icon so you get the notification for upcoming videos. Now, during the preparation, it's normal that we get anxious. Some days our performance get to the level where we want it. Some days our performance really drop. Okay, so it depends on day to day how you're feeling. So some days you do the questions and you're expecting to get the 50% and your score comes 60%, right? Some days your score comes 35%. So don't get too anxious based on your performance on day-to-day basis. Look at the overall picture. Look at the bigger picture. Are you progressing? Are you learning new content? Are you able to integrate information? That's all you need from the beginning. And I know in the final phase of preparation, yes, there will be a lot of tension, but be positive. You do your job, your scores and your performance on the day of the exam will reflect your hard work. Some common mistakes I have already mentioned in my past videos, but here these are. When students prepare for the board exam, they make some mistakes, and I want you to avoid making these mistakes. First of all, passive study. You don't want to study passively. For instance, what is passive study is that you have a goal that you wanted to study 30 pages, and now you are in the room or in the library, you're reading 30 pages, but your brain is occupied with the different thoughts, which is called the passive study. You are satisfying yourself that you did cover your content target, whatever you had, you covered your content, but basically how much did you retain? So make sure that you avoid passive studying at every possible cost, because your passive study, you feel satisfied that you did cover, but basically you did not. So avoid passive studying. Insufficient practice questions. USMLE exam is a conceptual exam, and you wanted to know how the examiners are thinking, right? So everything that you cover, make sure that you are doing practice questions on the covered content. For example, you covered physiology, cardiovascular system. Make sure that you do questions on that. This way, what will happen, you will understand how the examiners probably will ask me the question on this particular given topic. You studied preload, contraction, and afterload. Now it's time to test that concept in the Q bank, in the USMLE style. Okay, only focused on memorization. Another mistake, I get this a lot, that students say, oh, my senior said do the U word, do the first aid, and you are fine, you'll be done. So I would suggest that's not right. I would suggest that make sure that you cover your content from the review book. Yes, first aid is an excellent book, but again, it's a memorizational tool. Okay, it gives you the highest yield point, but you have to understand the background story. So review book or review video will help you to understand that concept. Memorization is an important component, and there are many ways and different strategies students memorize, and I have uploaded some of the videos in the past how to memorize the content, how you should write your notes. So those videos probably will help you. Okay, misreading and misinterpreting is another mistake. So I would suggest whatever you read, make sure that you are understanding it. You don't misinterpret the content, what is written in the book or what the professor is saying. The big mistake in the Q bank, when we make mistake and when we read the explanation, we say, okay, now I understand what the question was. That means initially you misinterpret the question. Try to avoid making that mistake. And the last thing I would suggest in the Q bank, make sure that you understand the question. Okay, make sure that you are very clear about what type of question they are asking, precisely what is the question. It's not about the detail in the question vignette, it's about what exactly they want. So pay close attention to that. I hope this video will help you to create a good study plan and progress throughout your step 1 journey. But if you have any question, don't hesitate to reach out. I wish you all the best, and don't forget to subscribe and hit the bell icon so you get the more notification in the future. Thank you.